about a month. His mom feels worried and guilty. She's a
Question
single mom,
6.
and he has a history of being late.
Yeah. So for our assessment, what we want to keep in mind most is what is impacting his intelligibility the most, because he does have artic, language, and fluency going on. So we're going to assess all three, but because we don't have a video and we don't really know what is, just kind of keep it in mind in case they say anything about that. That's something that we're going to keep in mind when we're assessing. So to evaluate the fluency, we wanted to start with having Ben play in a naturalistic setting with his parents. And that's going to give us our speech samples for the stuttering severity instrument 4. And that measures the frequency, duration of blocks, the secondary, like the facial grimaces, all of that will be measured with that. And so that'll be a very naturalistic setting for him, just to play with his mom when they come in and get that speech sample. Next, we want to do the parent interview with the stuttering supplement for parents of 2 to 11-year-old. And then in the book it says that interviewing after your play sample will help prevent biases. So we want to make sure that we do the play sample first and then the parent interview after. Next, we're assuming that we've been working with this child for a while, so he should already be warmed up to us, but in case he's not, we want to do a kind of a warm-up conversation playtime with the clinician and the child. And then that'll give us another speech sample for the SSI 4 if we need it. You need 2 of them, so get one from the parents and one from us. After we do that, there's 2 ways you can do this, and it's straight off Lisa's slides. If you go to, we have it listed there, the PWS, slide 5, I think, yeah. And the first one, she talks about eliciting 5 different representative samples. And you can see on the slides what she goes through, but the way that I think she prefers and the way that she kind of taught us to do it was the modified Stalker Pro technique that she talked a lot about in class. So I think that using that would be better than the 5 representative samples, just doing the modified version of that. And that is basically like, is it red or yellow? What is it? What does it do? So getting it at one word, a phrase, a sentence, and then conversation as you go through to see how severity changes with the different levels of linguistic complexity. And then the last little part of the fluency assessment would be the kitty cat, the communication attitude test for preschool and kindergarten children who stutter. Because we don't know if this kid is aware of his stuttering or not, you have either that or the puppet procedure. Those are the 2 choices that you can use. The kitty cat is standardized and has norms, so I think that one's a better choice to use. It's really quick. You just go through and ask questions without using the words stuttering ever, so you're not gonna ask the kid, do you know you're stuttering? It just goes through a list of questions and it gets at whether or not they're aware. The puppet procedure, I don't know if you guys know what that is. Basically, you put 2 puppets on and you have a little conversation. Brenna's done it. One puppet talks normal, one puppet stutters, and then you ask the kid, oh, which puppet do you talk like? And the kid will tell you whether he talks like the fluent puppet.
It has evidence base for it, but I run into that sometimes. Maybe it goes off task and the kid doesn't really understand what you're trying to do with it, especially if they're unaware. It's like, that one too, all of them. Just, I like puppets. And so I also like that the kitty cat has those specific questions. You get to know, like, is it something where they're saying no to a question like, do mommy and daddy like the way you talk? Or like, so they maybe are thinking about how other people are thinking about their stutter, or is it just all yeses to questions about how they feel about it's a little more detailed. But your choice.
Yeah, so we did put both choices on there because a lot of these you can pull different assessments depending on what your preference is. I mean, we're all going to answer it a little bit different, but I would use the kitty cat. I think it's faster and it's a little bit more reliable. Then we would want to go into reevaluating the language, and you could use the self-preschool too. If you wanted to use something a little less structured, you could. Because intelligibility is such a problem, we want to try to get the SALT sample and do a language sample with him, but it might be pretty difficult because that was such a concern, was we can't understand this kid, so that might be hard. And then we also put the expressive one word and receptive one word vocabulary to assess just single word vocabulary knowledge and use, because he is a preschooler.
Oh, he was he had a vocabulary acquisition.
That's right. Then we would move into the articulation and phonology, and the two tests that we chose that we think would be appropriate for him are the Golden Bristow and the Conn-Lewis phonological analysis, just to go through that section as well, so that we do best practice 2 tests in each area of concern and see where he comes out in that when we're providing this assessment for the next clinician.
And for parent counseling, so we have a set of interview questions that we put together here. Obvious ones: history of stuttering in your family. Do you think Ben's aware of his stuttering? Has he been teased about it? Just checking out for risk factors and things like that, and his attitude, and when he stutters the most and least. Is it consistent? When is it worse? And then an intelligibility question: how well can you understand, or how well has Ben understood by familiar and unfamiliar listeners? And then for education and counseling, just some facts about stuttering that you guys probably all remember from the slides.
It's just like a dense paragraph.
Yeah, just a couple of paragraphs about, the spontaneous recovery and things like that, and what types of stutters, educating the parent to look out for which type of stutter means that the kid is more likely to keep stuttering, and all of that stuff.
Some comforting.
Yeah.
Stutter's not your fault.
Yes, definitely. So she feels guilty, so comforting mom. What time do you guys want to leave, by the way? Are we going to the library?
Yeah.
We're gonna,
Okay. So I'll just quickly. So you can read through these paragraphs. So it's basic counseling stuff. Letting her know some resources, websites to go to about stuttering. Referring her to the next SLP who will monitor Ben, because he's only going to be with us for the few months or something like that, because he's finishing his preschool program with us, I think. Yeah, I think that's.
okay, cool. Okay, so treatment. Lisa put in there that Ben is making rapid progress, and I'm not sure why that's great. It's not like language issues just go away, and I don't know if we're going to wrap up all our TIC in preschool. So I would keep working on everything else we've been working on in therapy. He hasn't been stuttering for super long, but mom is concerned, and he's already through the door of special education, so we can start working into our therapy with him. I would do the cyclic approach of cycles, where you either by the activity or maybe the time, like session to session, you change what you're targeting. It's way easier to take data. And there's an idea of treatment concept confusion, however legitimate that might be. It would reduce it to just focus on one thing at a time. So he has a really low time since onset. It's like a month. So we would, as a preschooler, be looking at indirect or direct approach, or an integrated, more blended approach, if you liked that. I think Lisa likes that. So you might want to say that. But those indirect techniques are the partner slowing their own speech rate and recasting those disfluent utterances, simplifying your own language, and then extending the length of utterance and or gradual increase in length and complexity of utterances, both of which are evidence-based. Gradually working your way to more complicated language demands. Finding those islands of fluency, and then as you're doing this, I might even do like a little trial period of indirect. This is if he's not aware, if the risk factors that we don't already know from the question are absent. Maybe he has no family history of stuttering, that kind of thing. Like he has no negative feelings about it, and no awareness. You might try a little trial period of indirect, see how it goes, check in with the parents. How's Ben's fluency been? Like, let's take some data, see if it's making a difference. And if it's really not, well, and you would normalize stuttering, whether you're doing indirect or direct. Everybody has bumpy speech sometimes. But maybe if that trial period doesn't work out so well, you start introducing some direct intervention, which you might start with if he was aware of the stutter. If fluency is really severe, if it's more mild, you might start with indirect. Or if he's got that genetic component, maybe brother stutters. So direct approach is lid cone link, contingent stimulation, 5 to 1 praise to corrections, and it's super effective for preschoolers. There's definitely an evidence base behind it, especially for kids who are negatively aware or even just like totally oblivious to their own stutter. And I mean, everything has pros and cons.